Ladies and gentlemen, my name is Michael Diamond. I'm the Director of Administration of the school. It gives me great pleasure to welcome you to the Physician's Oath ceremony of the 15th class of the Medical School for International Health in collaboration with Columbia University Medical Center. Allow me to introduce our honoured guests. Standing in for Rector Professor Aryeh Cohen is Deputy Vice President for Dean and Research, Professor Dan Bloomberg. Standing in for Dean Professor Gabi Schreiber is Professor Doron Zager, Deputy Dean of the Faculty of Health Sciences. Here in person is Ben Gurion University of the Negev Director for the Medical School for International Health, Professor Mark Clarfield. Also present all the way from New York, our Columbia University Director of the Medical School for International Health, Professor Richard Deckelbaum, and Head of our Admissions Committee and Associate Director of Student Affairs, Dr. Lynn Cotel. And of course, our distinguished guest of honour, alumnus of the class of 2007, Dr. John Langston. Distinguished guests, faculty members, students, and family and friends here in Beersheba, as well as those gripping their seats at the other end of our live internet broadcast. Thank you all for honouring us with your presence. I would like to invite Professor Mark Clarfield to make his introductory remarks.
I'm much taller than Mike Diamond. Thank you very much, Mr. Diamond. I'm going to break with tradition and not repeat as the 5 people that Mike mentioned, all of our honored guests, and I hope you won't be insulted, and I hope you'll also continue the tradition and not do it yourselves. But it's up to you. Mike already introduced that. I really am very happy that you're all here. No jokes. When I thought about saying just a few remarks to you, because this is not my evening and I'm not the main speaker, I was in Mike Diamond's office thinking about something, and I looked at this. I thought this was a very good metaphor for many things. Hourglass. I know the students probably don't know what it is. They're a different technology generation. Do you know what this is? Why did I look at this? Because I think that it tells us 2 things. It tells us a little bit about time. And I'll use it to keep Dr. Deckelbaum in check as soon as he's done, and I'll turn this over. And it'll tell you something that you think that you've got a long road ahead of you. And the truth is, medical school goes very, very quickly. I have another thing to tell you, that life goes even more quickly. So before you know it, you're going to be finished. Before you know it, your residency is going to be over. Before you know it, you're going to be physicians. Before you know it, you're going to look like me. Not the women. But more important than time, the shape, I've always been intrigued by the shape of an hourglass because it looks like this. It's wide at the top, and then it gets narrow, and it gets wide again. This is you guys right now. You've come from a broad spectrum of places and cultures, languages, and you're all different. But what we do to you in medical school, this medical school and every other medical school in the world, is we put you through this little narrow part. We socialize you to be doctors. When you're finished this medical school, you will have much more in common with any doctor from any medical school around the world than you do with many other people. It never leaves you. And right now you're here, you'll come out again, and you'll differentiate into different kinds of physicians. You don't know what kind of physician you're going to be just now. You may have some ideas. For those of you who don't know, I'm a geriatrician. I look after very frail old people. And I had no idea when I was sitting there, or even years later, towards the end of medical school, that I was going to be a geriatrician. Not an idea. I was exposed to it, I became one. Thinking about geriatrics, I think about my dad, almost 93, my mother, 90, who were actually quite well, and certainly with it upstairs. And I'm reminded that my dad told me around just before I went into medical school, he said there's 2 important things, 2 super important things in life. And this will be relevant to half of you. He said it's very important to pick the right wife. It's relevant to you too, to pick the right wife. But it's also very, very important that you pick the right profession. And I can tell you people, and women and men, you pick the right profession. Thank you very much.
I'll never look at that hourglass the same way again. Thank you for Professor Claffield. I would like to invite Deputy Vice President and Dean for Research and Development, Professor Dan Bloomberg, to address the audience. Professor Bloomberg.
Thank you very much. Good evening. I need to stand on this thing or not? Am I taller this way? I guess so. Anyhow, first of all, I'd like to apologize for the rector, Professor Aryeh Cohen, who could not make it here this evening. He has to appear. We have an ongoing public debate, and he has to appear on TV now. So he was unable to attend this meeting, or this event, I should say. Having said that, I can tell you from last week I've been sitting in for him, for the president, for both vice presidents. Everyone's been abroad. And of all the things I had to do, signing all day long, this is the only event that I'm probably going to enjoy. Everything else was just duties. So I'm happy to be here. Mark, you tackled me. You said, don't mention all the people, and I have a whole list of people that I should have mentioned. But I'm not going to mention them, except for two, M&M. We all like M&Ms. And I want to thank Mr. Mike Diamond, the first name, and the other one is Professor Mark Clarabelle, who are actually doing all the work behind the scenes for BGU, for the leadership of BGU, and making all of this happen. I'm also here mainly to welcome you to Ben Gurion University of the Negev. You started a couple of months ago, I believe, but you're at the beginning of a long road, a road that's you're going to feel it's going to go fast, it's just going to fly by for you. But it is a long road. You're going to do a hell of a lot during this time that you're going to be here in Beersheba. You're the 15th entering class, and you're the class of 2016, so it's kind of easy to remember that combination. I even called Mike this morning to make sure that the 15 and 16 haven't got mixed up. You're here to learn, to study, and to experience a new way of thinking. We at BGU want to try and give you something while you're here beyond medical school. The achievement of excellence in a program with a humane and social orientation doesn't come alone. It comes also with a friendly and fruitful and challenging environment. You're here at BGU. Most of you have not lived in Israel before. It's a far distant place for you, for many of you. Yet, you're going to learn a lot. You're here in an international program. And being in an international program actually means something. So what is global medicine? That's actually part of what you're learning here. Most doctors get up in the morning, correct me if I'm wrong, I'm not a doctor. Most I can do is study a stone from the kidney or not, as a geologist. Most doctors get up in the morning, go to their hospitals, go to their offices, and check patients, irrelevant of where they are. However, there's a growing recognition worldwide that to meet the needs of globalizations, you need to be able to function in different environments, in cross-cultural environments, and in international arenas. That's part of what we want to try and give you here, is the ability to do that at the end of your studies. Something beyond going to medical school at Columbia University, or at Tel Aviv University for that matter, or any other university. Your studies and degrees going to be from both BGU and Columbia University. The program that you're in is based on the values and reflects the values and standards of both these universities. Each one with its own values, although there is a lot in common. BGU was not built here just because there was a place to put up another university, Tel Aviv University. I'm just mentioning Tel Aviv University. Let's switch to another university. Technion could be in Tel Aviv. Tel Aviv University could be in Haifa. But Ben Gurion University of the Negev could only be in the Negev, in Beersheba. And when you finish these studies, we want you to remember something about the Negev. You're going to be here during the interesting time. You probably started feeling that there's never a dull moment in Israel. Every day is a new day. You turn the TV on, there's news, and the news actually means something. But while you're here, you're going to see a lot of changes in Beersheba. Part of it across the road from here, the advanced technology talk is one of the things. Look around. Don't sit only in classrooms and study medicine, although at the same time, we want you to study medicine. Don't leave here without being the best doctors you can be. But part of that is looking around, getting something from the environment that you're in, experiencing Beersheba, experiencing Israel. And at the same time, I want to wish you all a lot of success. Prime Field, Israel, you're going to see it's a fun place to be in. As I said, there's never a dull moment. Have a good time while you're here. Enjoy yourselves. And lastly, but not least, have a wonderful Shana Tova. Both the New Year Chag and the year. Have a wonderful year and a wonderful time while you're here. Good luck in your studies.
Thank you, Professor Bloomberg. Hi, Julie. Thing to stand on. I just wanted to make a comment that whereas I appreciate the credit given by Professor Bloomberg to myself and Professor Clarfield, we couldn't do anything without the staff that work with me, and I really want to give the staff a round of applause because they really do very, very I'd like to call upon Professor Richard Deckelbaum, the Columbia University Director of MSIH, to give his address.
Am I taller than Mark? There it is. Dear honored members of the front row, and welcome to the class of 2016. And Mark, can you start the hourglass?
I did.
And
it's over.
I'd like to bring you greetings from Columbia University Medical Center, particularly from the Dean Goldman and our key New York MSI staff, Pamela, Alice, Sarah, and Denise. And from over 400 Columbia faculty and staff who have been helping and working and teaching MSI students over the past 15 years. So you're here to become global health practitioners. That includes being researchers, educators, as well as clinicians. And we heard from MSIH alum John Langston yesterday how being creative and resourceful helps so many people in South Sudan. Let me now tell you a bit of a personal history just about two patients. And there I am working in Mayombe, Zambia, busy clinic. Suddenly there's a commotion, and they bring to me a mother and her 1.5-year-old boy. Mother had been in the fields chopping a tree which fell on her and the child. She was pregnant, and her abdomen size was growing, and she was pale. The boy was unconscious and had a depressed skull fracture, a subdural hematoma, blood collecting underneath the skull. And I knew we were going to have to drain him. And how do you drain it? You do what's called a burr hole. But we didn't have any tools to do burr holes. So, what am I going to do? Well, I got them to call the village carpenter. And we put his drill and bit into the steam sterilizer, sterilized it, wrapped it, and then my new wife, Kaya, put him on her lap, and mother in the back of the Land Rover, and we head off for Malawi, 60 miles, 4 hours away. That's how good the roads were. And we're well on our way, And after about 2 hours, the boy stops breathing. His eyes get dilated, the pupils dilated. This is a sign that this is bad. We stopped the car, and while my wife's holding him, took the drill, and I made a hole, and the blood spurted out. And he started breathing, and his eyes got better, and I thought, this is good. An hour later, he died. My wife holding him. And then we get to the hospital in Azuzu. They take the mother right away to the operating room. She had a ruptured spleen, and they saved her life. So here, partial success. But I still wonder, should I have done that hole, filling that hole, before we left and gone on the trip in the Land Rover? I still wonder, might I have saved his life? So yes, as you go through your education and career in global health, you've got to be creative and resourceful, starting now. But also question and be aware of your limitations and how you might always do better. Good luck to you.
We will now, thank you, Professor OBrien. We will now hear a Spanish guitar medley by classical guitarist Aryeh Cohen. dead. The Physician's Oath Ceremony, now an annual event at many medical schools around the world, originated in Israel at Ben Gurion University Medical School in 1974, when the late Professor Moshe Priebus, founding Dean of the BGU Faculty of Health Sciences, decided that students taking care of patients from the first week of medical school should be sworn in at the beginning rather than at the end of their medical training. In the tradition established by Professor Moshe Priebus, students of the first year class will now take the Physician's Oath. I call upon Professor Shimon Glick, past Dean of the Faculty of Health Sciences, and Professor Emeritus at BGU to approach the lectern. Please rise.
New physicians, you stand today in the presence of your teachers of medicine and its precepts. You enter into a covenant with medicine to fulfill its commitments to the best of your ability, with wisdom and integrity. That there may be established a generation of physicians motivated actively and dedicated faithfully to aid the suffering human being. This is the covenant into which I enter with you today. You are charged to stand at the side of the suffering individual day and night, at all times and at all hours. You shall protect human life maximally from the mother's womb, and let its welfare ever be your chief concern. You shall help the ill, whether stranger, alien, or citizen, of whatever social status. You shall seek to fathom the soul of those who are sick, to restore their spirit through understanding and compassion. Do not be hasty in judgment, but consider your advice carefully, tempering wisdom in the crucible of experience. Be faithful to those who put their trust in you. Do not reveal their secrets, nor act as a gossip. Honor and respect your teachers who have labored to guide you in the path of medicine. Guard the honor of your colleagues zealously, for their honor is your own. Increase wisdom and do not become worn down by the struggle, for wisdom is your life, and it has the power to sustain life. Use your wisdom for the health of the public as well, to bring healing to the ills of the community. May the words of this covenant be close and dear to you, articulated clearly and felt deeply, that you may carry them out. And you will all respond, Amen.
Amen.
You may be seated. Thank you, Professor Gill. I would like to ask Dr. Lynn Cotell to introduce our guest speaker.
Welcome to the class of 2016. It's great to see all of you. It is really my pleasure to introduce our speaker tonight, Dr. John Langston. Dr. Langston graduated from the Medical School for International Health in 2007. During his medical education, he received the Gold Humanism Award, and he also participated in the Israeli response to Hurricane Katrina in 2005. He completed his residency in emergency medicine at the Sinai Grace Hospital, Wayne State University in Detroit, Michigan, and then did a fellowship in international medicine at Vanderbilt University in Nashville, Tennessee. And we asked him the other night if he goes and listens to music a lot, and I does take advantage of that because he's working so hard. And he is also presently assistant professor of emergency medicine at Vanderbilt University. He has had extensive global health experience, including work in Ghana, Guyana, Ukraine, Haiti, Ethiopia, Israel, Cameroon, and South Sudan, just to name a few. His entrance into medical school was really not a straight trajectory, but rather a very circuitous route, including 12 years as an emergency medical technician. And his circuitous route and his trajectory eventually, which really eventually was quite uphill, was really all of his own doing. I clearly remember meeting Shannon. I very much remember reading his application to medical school. And I really remember you on interview day when he was pretty shell-shocked at being in Washington Heights in New York City. Little did he know, he'd really never spent much time out of the southeast part of the United States. And little did he know what he was in for, going to Israel and then embarking on all of his travel around the world as a physician. But what the committee saw in Shannon were the values and aspirations of what we wanted for our students at the Medical School for International Health. And you have truly lived up to those expectations and beyond, both because really primarily you have reached your goals, but also because you have fulfilled our goals in the education of a new breed of doctors who are committed to global health. I want to thank you very much for coming and being our speaker at the White Coat ceremony. And I also want to tell you that the reason that he is here today is not because we have chosen him, but he really was chosen by our newly formed Alumni Association as a representative of our school and of our graduates. So thank you, Sharon.
It's great to be back in Israel. I wrote my speech out. I'm always afraid I'm going to be in front of 100 people and I'm going to forget exactly what to say. So if you don't mind, I'll look down at my notes from time to time. Lynn, thank you for the introduction. It's very nice to be back in Israel. I was surprised when I returned here. It felt so much like home. It was like coming home again, something I never really expected, but with my transition, it was not the easiest of transitions. As I look back, though, as difficult as my first year particularly was in Beersheba, there's some of my fondest memories, being in Israel and traveling and being in school and meeting and getting to know all of my classmates. It was probably the most transformative experience of my life for not only my career, but me as a person. I hope it'll be the same for you. If you were to ask me 20 years ago what I'd be doing in 20 years, speaking at a medical school in Israel that I graduated from at a ceremony would probably not come to mind. I probably would not have guessed that I've been on 5 continents in the past year, or I've been to more than 20 countries since I started medical school here. It simply wasn't in my planning 20 years ago. So I came to Israel in 2003. Part of my visit, my knowledge of Israel was really limited to television, mostly to the news. I was a fan of Israel. I was a fan of the military. I grew up in the South, so who isn't? I'd never heard Hebrew. I never met a Jewish person knowingly. I'm sure I had somewhere along the route, but I lived in a very small town. I was the first in my family that ever pursued college, although I never intended to. My hopes were to get a good trade, a modest home to live in, and a reliable car. Although I've rarely discussed it, I recall looking over the application to medical school, with the electronic and the printed form I think they used at the time, and trying to decide how to enter the date I withdrew from high school. For some reason it wasn't on the form. I was like, how do you put that? I didn't know. I just put something. I withdrew from school at the age of 16. I attended a local community college at night, took classes, and I got my high school diploma. After that, I pursued a career as a paramedic. By the age of 19, I was a paramedic in charge of my own crew. Growing up, I'd never seen anyone attend college. I'd never known anyone personally that attended college. I thought it was for wealthy people. I didn't grow up with a lot, so I limited myself. I made friends with someone that made me believe that anything was possible. Of course you can go to college, anyone can. My limits were self-imposed. So I worked full-time as a paramedic. I took classes. After working nights, straight nights, I attended classes during the day. I would go days without sleep. I would apologize to my professors often, and they saw my work, and seldom would they say anything. They were like, oh, it's okay, you probably work hard. For years, my vacation time was used simply for exams to show up so I could take tests, or for study time. Once I was offered a scholarship, I returned it. I was able to pay my tuition, so I gave it to someone else. I recall taking my organic chemistry book on the ambulance with me. I would read it between calls, and occasionally I would hop in back and I would take a nap as they're driving to the next call. And I would get out, and they would bang on the door, and they'd get out, kind of groggy, and deal with whatever else came up. Despite it all, I got good grades, and despite the sleep deprivation. I studied anthropology in college. As a child, I didn't have much, but I had access to some books in the library. I read about Africa, I read about tribes, I read about Petra, the pyramids. I wanted to see them one day. No one in my family that I know of had traveled from the country. So the chance to attend MSIH and to live abroad, it was a dream come true for me. So coming from a small southern town, I don't know how many of you from the south, but it stood in contrast to where I came from. So the culture was different than where I grew up. When I first arrived, there was supposedly a roommate to meet me at my new house, or a temporary house, until I found an apartment. When I got there, he got a date in Tel Aviv, and so he took off and left for the weekend. So I was a little shell-shocked arriving to Beersheba, to a house where I didn't know anyone. I didn't know the neighborhood, and I didn't know the language. I just sold my first home, an old farmhouse that I had, and I quit a job that I'd had for 12 years to come to Israel. So I decided to journey through the neighborhood. I'm fairly adventurous. I'm a hiker. I grew up in the woods mostly, but I can hike through a city. So I went to find food. It was quite interesting. So I found a little grocery store, a little community grocery store, and I started looking through the shelves. Everything was in Hebrew. Some was in Arabic, I think in Russian. I didn't recognize what it was at the time. I stopped in the dairy aisle. By the way, amazing dairy here. So I stopped in the dairy aisle, and everything was in Hebrew, and they've got all these things. I don't know what they were. They are all white. And so, what were they? Were they cheese or yogurt? Sour cream? Was it something else? I don't know. I didn't know if you cooked with it or ate it out of the container or spread it on bread. I literally sat at home and tasted all of it. That's the only way to find out, right? I placed in my chart and I kept shopping. I found something I recognized. I found a can with a picture of a chicken on it. I remember this distinctly. Oh, it's for chicken. Everybody knows what chicken is. And I picked it up and I put it in my cart and I started thinking, well, is this boiled chicken? Is this roasted chicken? Is this chicken chunks, or is it cat food? I took it out of my cart. I was like, never mind. I'm not that adventurous yet. So I put it back, and I decided on bread. Bread is bread everywhere in the world, and it's safe to eat. So I took bread and cheese home. But while I was in the store, an old lady pushing her cart just ran me. Just pushed me right out of the way. Didn't look at me, acknowledge me, apologize. Apparently I lingered too long. So as I was walking home, I was passing people, and they were walking toward me, and they didn't make eye contact really. Where I'm from, I'm a small place, you make eye contact with everyone. And finally someone did, and I waved at him, nodded my head, and he stopped and he looked at me, and he asked something in Hebrew. I told him I didn't understand. He's like, do I know you? I was like, no, I don't think so. And he's like, why did you wave at me? I tried to explain, well, where I'm from, his Hebrew was worse than my English, so I couldn't explain. I knew I wasn't in North Carolina anymore, that's for sure. It took time, but Beersheba, Israel, it grew on me. And I've missed it more times than I could have imagined. The education I've received here was world class. It served me well, and I think it'll serve you well. So the white coat you received tonight, or you wear tonight, has symbolized the position for approximately 100 years, a little over 100 years. The traditional dress of the black street clothes was abandoned when they started killing germs and practicing aseptic technique and trying for sterility. It was originally worn to symbolize science, or before the quacks were wearing street clothes, just like the physicians. They wanted to separate themselves. In the roughly 100 years since its adoption, it's come to symbolize not only the uniform of the physician, but it represents trust, integrity, and knowledge. It often creates a sense of safety and atmosphere for your patient to allow them to tell you what it is that's bothering them, whether it's embarrassing or difficult. They'll be open. Most would agree that you become a physician the day you graduate from medical school. That's when you get MD. You get those part-M letters behind your name, and they're with you for life. But when do you become a doctor? Is graduation the defining moment? Is it the title? Is there something inherently special about the day you graduate that all of a sudden you get doctor knowledge? I don't think that's what makes you a physician. Perhaps it's the moment you assume responsibility. Not the responsibility of a medical license, of the legal responsibility, but the responsibility placed upon you by the patient's expectation, their view of your place in their care. By wearing the white coat, you will be seen as a physician, even as it's one in training. Although your responsibility as a student is to learn, to become competent is not lessen your responsibilities to the patient. It doesn't lessen your obligations to keep the secrets of the patient as they divulge their life history to you, their darkest fears. They trust you by allowing the most vulnerable and invasive of examinations, painful procedures. I think that today, when you get your white coat, you assume the role as a junior physician. And when you walk into the ward with a white coat, you take on those responsibilities. The responsibility to do the best you can for the patient. Always remember, no matter what oversight or supervision you receive, they are your patients. You assume responsibility for protecting their information and dignity and providing the best care you can provide. As you progress through your studies, I ask that you be mindful that you're not studying to become a physician one day. You're practicing being a physician as you go along. Learn from those qualities, from those that come for you. Adopt those positive traits that you admire and let go of those ones that you don't, that you have no place in your practice in the future. In this way, you can find a path to being a good physician. This is what both you and your patients want. When I was a student, studying hours for examination and preparing for boards, I told myself that all I wanted to be was a good physician, a competent physician. And some colleagues and I recently, on a trip to Ukraine, were discussing it on a train ride. And I asked, what is a good physician? And I often thought it was knowledge, a smart physician, an intelligent physician. That's competence. Being aware of the latest in medical abilities, having good hands, being a procedural expert. These are responsibilities as a physician. These are what your patients expect of you. I suppose the answer to what makes you a good physician depends on who you ask. However, I have learned a lot from my patients. As an emergency physician, I see people of all walks of life. In a matter of moments, I often go from treating a homeless person suffering from addiction and mental illness to providing care to someone that's very privileged, suffering from a stroke or an accident. The extremes are what drew me to it. When they come inside my doors, I'm aware they didn't make an appointment to see me. They didn't ask for my reputation, nor did they ask which doctor was on tonight. They simply come in. When they come in, they expect that I'm good at what I do, that I'm competent. They'll never see my medical school grades. They'll never see my board scores, examination scores. They'll never know if I finished in the top of my class or the bottom of my class. They expect that I'm competent. What they will know, however, is how I treat them. They'll know that if I place them at ease when they describe an embarrassing medical condition, they'll know if I'm open and honest with them concerning their condition. They'll know if I place them at ease as they express their fears to me. They can tell if I'm sincere and caring, or whether I'm really interested in them as a person, or whether I'm rushed and hurried and I'm wanting to get on with my day. They can tell you that. And while we're trained as physicians to consider the differential diagnosis of abdominal pain, weight loss, fever, chest pain, always remember the patient's not thinking the same thing as you are. He's worried about the possibility this is something serious. He's worried it could alter his life. He's afraid of something terrible, perhaps cancer. And he's concerned about missing work and whether it'll get him in trouble or get him fired. Will missing work lower his salary? Will he be able to pay his rent and keep his lights on? He's worried about his family should anything happen to him, or how we'll pay for this treatment that's often very expensive. Sometimes we go through the mental checklist of the possible diagnosis, and we order a panel of blood tests, of lab tests, we order procedures, we order imaging, and in the midst of all of it, we failed to address what brought the patient to the emergency department or the hospital in the first place. He was afraid or he was in pain. Treating them as a person, an individual with a history of family, with unspoken fears, with genuine compassion, that is the way to be a good physician, a great physician. My favorite quote that I learned during my first year, I believe it was by Dr. Jokowitz actually, is from physician Francis Peabody. And the secret in the care of the patient is in caring for the patient. I met one of my most transformative patients in a pediatric ICU while I was a student here. He was 16-year-old from the Dominican Republic. He'd been having stomach pains for several months. He wasn't eating, he was losing weight. He went to different hospitals and finally they diagnosed him with lymphoma. I guess the imaging wasn't readily available, but when he got the imaging, it was very far advanced. It was spread throughout his lungs and his abdomen, and he was very sick. His family was fortunate enough to transfer him to the United States for treatment. He was very small for his age. He looked weak. He would only make eye contact when you talked with him, but otherwise he didn't speak to anyone. He stopped eating. Eventually he stopped making eye contact with everyone, and he would just occasionally blink. He did CT scans, MRI. They were really afraid of the worst, that it had gone to his brain, that it had metastasized. They didn't find anything. They did lumbar punctures. Perhaps they'll find it then. Absolutely nothing. It was clean. They started doing metabolic panels. Perhaps it's something in his bloodstream that's causing his altered mental status. Nothing. One day I was doing a morning exam on him. And as I went to leave the room, I saw him glance at me. It was the first time I saw him do anything but look at the ceiling. And when I did, I shut the door. And I asked the nurse to give me a few moments. And I went in and I talked to him. I sat down on his bed and he still didn't look at me, and I said, simply, I'm sorry. This sucks. You're 16 years old. Instead of playing with your friends, playing baseball, enjoying your life, being with the people you care about, you're in a hospital in another country, getting needles poked in every day, and getting medicines that make you incredibly ill. I'm sorry. We're going to try to make you better. We'll do everything that we possibly can. But I know that this is hard for you. I'm sorry. And I walked out. I told him before I left, if you ever want to talk, I'll be willing to talk to you. So as I walked out, I noticed he was crying. I didn't say anything. I kept walking. And later the nurse came to me and she was like, what did you say to him? I was like, I don't know why. He asked when you were going to be back. Every day after that, I started wanting to see him, and he would talk to me. We talked about baseball. We talked about his home. I don't like baseball, to be honest. But I talked with him about baseball, and he was very happy. He started getting better. He was eating, and he started undergoing chemotherapy. The last time I saw him, he was in an ICU, and he was very sick, undergoing chemotherapy. He had a fever. He was delirious. It was time for me to leave for my next rotation. His mother gave me a small rosary bead that he had held every day. It's like he wanted me to have this. I keep it on my wall throughout me. So I'm not religious, but I do keep this to remind me of what patient care is like, of what caring for someone is like. So in the past several years, I've spent a lot of time abroad, particularly in developing countries. As I perform my work, I try to remember the lessons I learned here at MSIH. I've often relied on the medical ethics I learned, thanks to Dr. Glick and others. During my first year as a student, like you, my class crafted the notes. I tried to recall an honor, particularly in difficult situations. During a recent trip in Ghana, I worked in an emergency department. It was very busy, and I worked in the most critical area of the emergency department, training residents and taking care of patients. Most of the patients arrived after multiple delays. They came from very remote regions, and they often have very little resources. There were more head injuries and strokes than I'd ever seen at any hospital I've ever worked in. genetics, high blood pressure, motor vehicle accident. There was a lot of reasons why. There were a lot of sick people. I saw a 40-year-old female that came in, and she had apparently had a stroke inside of her head. She had bleeding inside of her brain. She was critically ill, so I placed her on life support right away. I managed to get a CT scan of her head after some time to see what kind of stroke she had had, and it was horrible. It was a catastrophic bleeding inside of her brain that we couldn't fix anywhere in the world. The injury was just too severe for the most. It was just incompatible with life. It was a dilemma. So what did I do then? Did I let her linger on life support for days until she was ultimately going to die? Or did I just discontinue it? There was no policy there for discontinuing life support. There were no laws in the country that addressed the issue. The staff wasn't really familiar with what to do. And so I recalled from my training, there were two questions. I guess one was medical and one was a moral question. How did you address it? One, is she brain dead? Is she going to survive this? And the ultimate answer was no. I performed a modified brain death test, and she eventually lost all of her reflexes, and there was no chance she was going to recover. And the next was, is it right to take her off of life support to give someone else an opportunity? And the reverse of that was, is it right to keep her on life support and allow someone else to die while I keep her alive for several days? In the end, I decided it wasn't right. So I did what I thought was right. I took her through the protocol. I did the neurological test and decided she was brain dead. And the resident at that point asked that I not make him do it. And I did. I told him, it's okay, I understand, I won't. So her family couldn't be there. They were from a remote area and they were very poor, so they couldn't afford to be there with her. So I went to her bed, and the nurses and everyone had avoided her because they knew what her fate was going to be. There was no need to either spending time or getting close to her because she was going to die. I put up a chair beside her bed and I unplugged her ventilator so it wouldn't beep, and I unplugged the tube. And I sat beside her and I held her hand until her heart stopped. I said a prayer and I talked to her. And I hoped that if my family member was ever in a similar situation, someone would do the same. And I recalled something I said in our oath. And it said, when the limits of medicine have been reached, to hold the hand of the dying shall be our highest honor. And I recalled that I was sitting there holding her hand. So, as many of you know, I trained in emergency medicine at Wayne State, Detroit Medical Center. It is known as one of the toughest neighborhoods in Detroit. Not really kind and gentle. It's not known for being fuzzy. I did it for the unparalleled experience, for the procedural abilities, and for the pathology that comes. The hours were difficult. As one resident put it, you'll see everything at least twice. My patients consisted of heroin addicts, gunshot victims, neglected chronic diseases, and people suffering from poverty and lack of education. Among these were amazing, hard-working, everyday people that were caught up in a very difficult city, in a very difficult place. They were tough as nails. We called it Detroit pride. So in this setting, it's no wonder that the only real complaint I received during residency was, multiple times actually, I got this same complaint: you spend too much time with your patients. Well, I like spending time with patients sometimes, most of the time. And my bosses were not totally unaware of the contrast in value between what I learned here and what I was learning in Detroit. They were my mentors and eventually my friends, but they taught me to be a competent physician. However, people were sick, and more sick people were in the waiting room. You had to see them all. Move along, Langston. You got to see the next one. Come on. You've been in there too long. I heard that a lot. I memorized it. I promised I would work hard and I would stretch my limit, my capacity to see patients, even if it wasn't easy or if it didn't come as natural as it did for the others. My director seemed to possess the same compassion I did for people, and particularly, well, for animals and people. And she came from a small Midwestern town, was apparently very delicate when she started residency, but she was tough as nails after being in Detroit for a while. It had seeped into her blood. On a really busy shift one night, I found a young lady with belly pain, and she was holding a baby about 18 months of age. She was just old enough that she could smile and laugh and was entertained with the world. Well, when I talked to her, I got her history. No one had bothered to undress her or put her in a gown. I was inconvenienced. I was busy. I was trying to see more patients as asked. And I was like, here ma'am, here's a gown, please change for me and I'll come back and examine you. I'll be back in a bit. She's like, well, I don't have a lot of room. Can you help me? Okay, give me the baby. So she handed me the baby. I'm sitting there awkwardly, kind of holding the baby, and I shut the curtain. And I looked down at the baby, and the baby did what babies do. The baby smiled, actually. He smiled at me, and I was like, oh, that's kind of cute. And so I was caught up in this moment of being rushed and hurried and pressured, and I've got things to do, and I've got lab tests to look at, and the baby smiled at me. So I smiled back, and I could have made a noise or something, and I think I held it up. I said, "Make baby noises," and the baby started giggling. It was kind of fun. It was like a dark comedy. I look across the room as I'm holding the baby, and there was my program director. I was horrified. So I'm holding the baby, trying to deny it. No, I didn't have anywhere to sit the baby down. I was trying to hide it. And so the baby just continued to laugh harder, which made it worse. As she later and so eloquently put it, the whole place was burning down. People were bleeding, ventilators were beeping, gunshot victims were coming in. People were rushing in the doors, and Langston is sitting there playing with a friggin' baby. It wasn't until later, until the end of my training, that I sensed that she truly appreciated my compassion. She was doing what she had to do to get me through residency, to make me a competent physician. In the end, she allowed it, and she encouraged it, and she showed me true friendship. And as you approach your clinical training, work hard, study for the moment, study every moment you have to learn science necessary to be a competent physician. It does not come easily, and the knowledge that you're required to learn really is endless. You'll be learning forever. And in the midst of the struggles of medical education, amid the science, the evidence, remember that you're treating a person, not a disease. So it occasions sometimes to stop, to pause, to regroup, to ask your patient, I'm sorry, I was hurried. Can we start over? It works miracles. During residency, you often be judged on your speed, your efficiency, knowing the latest lab values of your patient, and providing an exhaustive list of differential diagnosis for your patient. These are all very important. But remember your patients and their reason for being here. They will judge you based on how you made them feel, how well you treated them, how well you treated their pain and addressed their fears. It's okay from time to time to be judged on being compassionate, even for entertaining a small child in a scary place. Thank you.
I'm supposed to read from this script now, but I just wanted to say something. Wow. Really, thank you very, very much. I'm pleased to call upon the representatives of the class of 2016, Abhishek and Adi Kalansky, to give the class address, and Ashley Boroba to read the class honor code.
You know what they say, Jamie? The class that plays together stays together.
I think it's more like the class that studies together stays together.
More like the class that inserts IV lines into each other with varying but generally low levels of skill and finesse together stays together. It still hurts.
Maybe it's more like the class that travels together stays together.
More like the class that gets stranded at IKEA in Rishon LeZion together right before Shabbat, and then has to pile into a taxi together with all of their furniture, like a clown car at the circus, come back to Beersheba together, stays together.
אתה יודע, הכיתה שלומדים עברית ביחד, אפשר ביחד.
זה יותר כמו הכיתה שמשחקים עם אייפונים ביחד. במשך שיעור באולפן, יקבלו עונש חינוכי ביחד.
In all seriousness, it is remarkable to be a part of a group of 31 individuals with such a unique constellation of spiritual, cultural, and familial backgrounds.
Some of us have built families and brought them to Israel together for the adventure of a lifetime.
We've worked in clinics serving marginalized populations.
We have devoted ourselves to the study of topics ranging from Mishnah to microbiology.
We've contributed medical research to improve both healthcare and the quality of life.
Our travels have brought us to dozens of countries spanning every continent except for Antarctica, as far as I know.
And in spite of all of these differences, we find ourselves here, in Beersheba, discovering our commonalities.
The class of 2016 is very unique. We have all developed strong moral compasses, and now we are pointed in the same direction.
As a class, we have built our code of ethics to reflect both our individual morals and our common ambitions for our careers and for the future of medicine.
As physicians in training, we are entering a life of service and responsibility in which we strive to fulfill the following principles. We will honor and be accountable to our community, our colleagues, and our consciences, and work to earn the trust that has been placed in us. We will seek to learn and practice the art of medicine with humility and integrity, endeavoring to build and reinforce an emotionally supportive and professional environment where we can learn and teach each other. We will recognize that our patients are whole people with emotional, spiritual, and physical needs, and that they are part of a family and community who are also affected by our actions. We will be free of prejudice, treating each patient with equal respect, and will act in their best interests, unaffected by personal motives or outside influence. We will respect every patient's right to make decisions about his or her own care, and will listen with open minds, offering treatment in consideration of their concerns and values. We will protect our patients at their most vulnerable moments by respecting their confidentiality and engaging them with sympathy, encouragement, and compassion. We will commit ourselves to the highest standards of excellence and to the lifelong pursuit of knowledge and personal improvement, and acknowledge the limits of our abilities so that we will always be able to offer our patients the best available care. We will work towards a more just world for all people, seeking to alleviate suffering where we see it, advocating for the underserved, and supporting our local and global communities. We begin our education knowing that our success as healers will be measured by more than simply our ability to treat disease. We are on individual paths, but we will move forward together, promising to strengthen and encourage each other as we work towards our common goal of compassionate service to all humanity.
Thank you, students. Prior to concluding our ceremony, Dr. Asher Moser will announce the Distinguished Service Awards for the year.
So it's my honor to present those who have reached the highest level of Distinguished Service Award for the academic year 2011-2012. And it is very much appropriate in the lines of what we have heard today, all the speakers, that these awards are presented at this ceremony because they represent what we believe is a high honor for a student to be awarded for. These awards are given to individuals, not from the intern class, but all the other classes, who have performed over a considerable period of time and continuously some kind of a service to an individual, to a group, to a community, without expecting to be rewarded or to be paid for or to get any personal benefit from it. In that sense, the entering class has a good opportunity in these coming years to put themselves in the footsteps of those who have came before you. So this time I'm presenting 3 individuals who are getting their awards. 2 of them are already graduating class, so they won't be here now. Do it briefly, and one of third grade. The first one is Jared Brasek. He has been awarded for editing the Balagan newsletter. Jared has led a team of responsible individuals and for the content, design, printing, dissemination of this Balagan newsletter over a period of about a year and a half when he took over from the previous editor. This newsletter contains items of medical education, interviews, global health, medicine, experiences, opinions, even numerous segments open to MSH and wider university and local communities. We found it as a highly professional, both in the content and in the population it's targeting, to be a representative publication of the Medical School International Guide. One. Second one is Deborah Block of the class of 2013. Deborah has been volunteering for the Israeli AIDS Task Force. She started her work back when she was a first-year student, decided to coordinate the MSH students in what seemed to be a day's work of helping with blood draws and maybe handing out pamphlets. It ended up to be a 2.5-year endeavor that she expanded her activities and organized week-long events, including education lectures, HIV-specific journal clubs, posters, of course, and she became an essential part of the Israeli AIDS Task Force in her being dedicated volunteer, and the person who submitted this says he hasn't seen before or after someone so dedicated to the job. And the third one who actually I would like to call up to receive his award is Toby Greenswag of the class of 2014. Tobin is receiving the award for his diligent work developing the electronic medical record system for the refugee clinic in Tel Aviv. It's not a secret that our students have been visiting this clinic for over a decade, and they've been helping in the work that's being done there. But when Tobin arrived into this atmosphere, he upgraded the system fourfold by computerizing it and developing the electronic medical records, or as we call them, the EMRs. He enabled the medical staff and volunteers an easy system in which to manage the treatment of mainly insurance-less people seeking help, which was in line with all we heard before. In addition, Tobin has been active in encouraging his fellow students from MSH and volunteering work at this location, and for that we would like to thank him and recognize him as the author.
Thank you, Dr. Moser. That actually concludes our ceremony. So you're invited now to go outside. There's a buffet outside, and we'll be coming in here later for the performances. I would ask, just before we finish, the front row, please, if you would stay here. I want to get some good photographs before we go to discussions. Okay? Thank you very much.